Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16 hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today, Mona Baset joins us. She's the Vice President of Digital Services with SCL Health. She has an interesting background. She comes from marketing, and we do talk a fair amount about marketing and how it's evolving as a discipline, but we also talk about digital services and establishing your digital roadmap, establishing your team to deliver on digital services for your health system. A lot of great content I think you'll enjoy. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. You know, somebody sent me a note and said, hey, how can we help out the podcast? There's two great ways you can help out the podcast. One is just shoot a note to a friend and tell them that you're getting a lot of benefit out of the show and that they should really subscribe to it. But another way you can really help us out is by, whatever app you're listening to the podcast on, go ahead and click and give us a review. Tell people about the value that you're getting from the show. We would really appreciate it. It helps us. It moves us up in the rankings in Apple and in Google and in the other services as well. And doesn't take that long, and we really appreciate it. Just a quick note before we get to our show. We launched a new podcast, Today in Health IT. We look at one story every weekday morning and we break it down from a health IT perspective. You can subscribe wherever you listen to podcasts at Apple, Google, Spotify, Stitcher, Overcast, you name it, we're out there. You can also go to todayinhealthit.com. And now on to today's show. This morning we were joined by Mona Baset, the Vice President of Digital Services for SCL Health. Good morning, Mona. Welcome to the show.
Hello. Thanks for having me.
Well, I'm looking forward to this conversation. I've talked to Craig Richardsville a couple of times, and the last time I talked to him, I said, what are you guys doing in the area of digital? And he said, you have to talk to Mona about the things we're doing in digital. I said, all right. So that's how you got on the show and how we got introduced. So I'm looking forward to this conversation.
That is great. Yeah, Craig is a wonderful connector.
Yeah, he is that. So let's. Craig actually gave us a good rundown of SCL Health, but tell us about your role and your team at SCL Health. What do you guys do?
Sure. So my role as Vice President of Digital Services was a brand new role when I arrived in September of 2019. And that's sort of exciting because I could really shape that role to fit the needs of the organization. And we really focus on consumer engagement and the technologies that enable those experiences. So my team has responsibility for things like our external website, our intranet site, our chatbot technologies, our CRM and digital marketing automation platforms, our MyChart user experience, and all those related technologies that really focus on giving the consumer a great experience.
Yeah, and so your background is, you came from the marketing world, is that right?
Yes, I grew up in marketing, so to speak. So I spent much of my career in marketing, working for many different organizations, healthcare, retail, financial services, and really spent a lot of time in marketing, brand management, marketing operations, marketing analytics, and really continued that focus on consumer engagement. So when I made the move to the technology side, as soon as I landed there, I was in love. It was an amazing experience, and I was able to take those experiences and just apply them slightly differently to still focus on the consumer and give them a terrific experience.
Yeah, I'll tell you, marketing is one of those things. As a healthcare CIO, I thought, well, I understand marketing, and I understand, I had my MBA, and I understand how these things work. And then I came onto this side. So I now run a podcast, and I'm doing digital delivery of those things and managing a website and interacting with the consumers. And I'm learning a ton of things that I didn't really recognize. Marketing is a really evolving discipline in the world, but especially in healthcare. And there's a lot of really cool tools that are available that give us the ability to really touch and hear from the client pretty often, and start to collect some information and provide value just all along the journey. How is that playing out in healthcare?
Yeah, marketing has just completely changed since since the early days, and digital has given marketers a way to really personalize, understand what consumers are looking for, get feedback from them, and provide really relevant experiences. When I think about where marketing has gone since I was, in my early days as a marketer, I think about how the consumer has just gotten a lot more control, which is great. It used to be the the marketers had control, they show the message, people receive it, and we hope they take action on it. But now the consumer has the control. So they can decide what they see, when they see it, where they see it. Oftentimes it's in context of other places they are. So marketers are meeting consumers where they are. And additionally, when consumers like something or don't like something, they have a lot of public forums to be able to express that feedback. And if you're a smart marketer, you will take that information, and it's real time. You will take it and adjust and act on it. So I think it's a wonderful time to be a consumer and also to be a marketer.
Yeah, I remember our first social listening campaign we did at the health system I was at, and it was pretty basic back then. We were essentially looking within our geography what people were saying about our hospitals and our doctors, essentially, but mostly our hospitals is what I'm going to focus in on. And we found out that people really didn't like the food at one hospital, and they didn't like the parking at another hospital, and they were pretty vocal about that. And the reality was, at that time, back in 2011, 2012, we weren't engaging them in those channels. So it was a one-way conversation. It was them essentially telling the world that, hey, the food at this hospital is really bad. And we weren't, first of all, we weren't listening at that time. So we weren't adjusting, and we weren't doing anything to really, I don't know, have a dialogue with people. Is that aspect really changing within health systems?
I think so. I mean, I think the whole, just this consumer mindset, which really was slow to evolve, I think, in the healthcare industry, is here. And I think the pandemic really accelerated that. And it's that consumer mindset that allows you to start looking at that information. And many health systems are doing it. So we listen to our consumers. We're always trying to get feedback and improve. We have a few different venues we do that, clearly in the online space and in social media, in the all the business reviews and ratings that they provide in those areas. We're looking at those and managing those. Additionally, we have some family and patient advisory groups where we get to talk one-on-one with our patients and their families and get feedback. I come from a design thinking background also, and I truly believe that if you watch your customers, listen to them, they will tell you everything you need to know about your business. And it's really a matter of organizing that information, really being disciplined about taking it and acting upon it.
Yeah. So let's see. I think where I'm gonna go off script. Of course, I go off script, but let's talk about you're pretty new in your tenure. You came in there. It's a new role for the health system. What does the first year look like? What do you have to put in place? What's the foundation that you have to put in place to move your digital strategy forward?
With all the work that we've accomplished and the pandemic slipped in there, the year and a half I've been here feels like a lifetime. So when I got here, I really started by asking a lot of questions. I wanted to really, ask people what's working well, what's not working well, what are the biggest challenges that are facing, organization, our teams. And I love the magic wand question. If you could do anything, you could wave your magic wand, what would you do? And then I also ask people if they were me, what would they focus on? because I think you get a lot of really good insight there. So I came in, started asking a lot of questions, also really did an assessment of our current digital landscape. What did we have in place? So we really did a formal inventory of what we had out there and an assessment of where we were, what we needed. So that really served as a basis to understand where the gaps might be. We also did some consumer journey mapping, pretty basic at that time, really looking at those moments that matter, truly matter in a consumer or patient journey with us. So what's the experience that they're having when they're learning about us, when they're finding a provider, when they're scheduling, when they are checking in for their appointments, any of the follow-ups, their billing. So we really looked at all those key moments and started mapping where there might be gaps, where we could improve, what technologies and channels we had to help support some of those, and where we were missing some things. So that was sort of the first stage.
All right. So at the first stage, you're doing an inventory, you're asking a lot of questions, you're talking to people, you're creating these digital journeys. Are the early on, did you worry about the different personas? Did you worry about the distinction between, a young mother versus a chronic old person, or did you narrow it down and say, look, let's just simplify and look at, the common things between those, or did you actually break it down by personas?
So our first step was the most common path, basically, because we wanted to move very quickly. And then as we started developing sort of the common path, then we could get deeper. And we looked at, the mom with, kids, and how she is really the chief sort of health officer of her family. How is she going to be going through this process? So we did look at it in both ways. Early on, we wanted to take that simple look, because I do think that there are some foundational things that just have to be there, have to be shored up, and you want to do those as effectively as possible. But we did both. And we have personas that we use for our website, for example. We have personas that we use even internally, and my team focuses on some of the internal things like our intranet site. So the personas certainly help with how we really structure the way we're rolling things out and the capabilities that we're offering.
Interesting. So what did you find in terms of, we're going to talk about where you took it, but when you came in, what did the digital set of tools or tool belt look like? Was it pretty, decisions had been made to go in different digital directions, or were they tied together pretty good, or a lot of one-off solutions?
Yeah, it was really interesting that you asked that. And I think what you're suggesting is what I found very early on is there were quite a few sort of foundational level digital platforms and solutions. So we had an external website, we had an intranet site, we had an older CRM implementation, we had our MyChart experience and portal. So all those things were there, but they were sort of at this lower, very basic level, sort of check the box. The other thing that I noticed was there are a lot of innovative people across this organization, and people who want to get things done and have lots of great ideas. And what had been happening in the past, when there really wasn't a digital services area, is that teams would go off and implement sort of these solutions on their own. So there were a lot of things dispersed across SCL Health that we wanted to try to bring in centrally, see if there's any duplication. Some of those solutions are great, and we've leveraged them. In other cases, we found better solutions for some of those. But I think when you look at all those solutions dispersed across an organization, you can't really manage them very well, nor can you really incorporate the expertise and the data and all the things you're learning to do it that way.
Yeah, I laugh because I tell the story early on in my CIO career in Southern California. One of my vendors called up and said, "Hey, you're one of our largest clients," and it was frightening. It was actually Dropbox, and it was frightening because I was like, back in 2011, Dropbox had like almost no security controls, and I'm like, Oh my gosh, how can we be one of your largest clients? And because we have very creative people who go out there and say, hey, we've got a problem. Hey, I'm doing this at home with videos. I could probably do it with medical images, right?
That's right. That's right.
And so you have to get your arms around those things from a security standpoint, but also orchestrating the experience. It's kind of hard to do it across a bunch of one-off type solutions. So you're ready to go to the next step and say, all right, look, we want to be more intentional about the experiences that we're creating. How do you take the next step?
Yeah, so we actually have a great steering committee. We have a digital services steering committee, which in fact was in place a couple months before I got here. And that really brought in the stakeholders from all of our key organizations across SCL Health. We have folks from marketing and HR, finance, revenue cycle, just about everywhere across our organization, operations. And that has really helped us be able to get our projects endorsed, get feedback on them, and move things very quickly. So when we had done that early stage journey mapping, identified the gaps, that team actually came together and helped prioritize the things that we wanted to do. I mean, we had a long list of ideas that we really wanted to implement. And so we had to look at things like, is this idea going to get us a big consumer impact, big patient impact? And what are the resources required to do that? So of course the no-brainers are low resources, huge impact. Of course we're going to do those. And then we really started to look at the things that had high consumer impact, but also required some additional resources to do. So we took that role and then we started developing business cases to get approvals on those items. And we have a very, very robust roadmap that came out of that. And even in just probably less than a year, we were able to implement a really big chunk of that roadmap. We implemented a brand new CRM. We implemented several different new chatbot technologies. We launched a new provider directory and scheduling experience on our website. We partnered with innovation to launch a new consumer app. So pretty significant things that we were able to get done. And I think what really helped was that support of key leaders in our organization.
Interesting. So the tool set that, well, actually, let me ask you it this way. So the governance group gets together and starts prioritizing things. What's the criteria? I mean, you sort of mentioned that the impact on the consumer experience and the complexity of the project, a very traditional approach to looking at that. But did you have some other criteria that the governance team was looking at to prioritize the work?
I think those were really the big pieces. We wanted to make sure that what we were doing would have an impact because we couldn't do everything. So we wanted to get the biggest impact items, which.
So you were looking for quick wins that would establish the digital, the digital strategy moving forward, I would imagine.
Yeah, and I think it just depends on how quick is quick. Some of those things definitely took a little bit longer. But absolutely. And there are things again that we wanted to look at that are very foundational that we just needed to do. So things that people are expecting us to have. And that's the other thing. Healthcare doesn't get a pass anymore with experience, consumer experience, all the tools. And so we needed to make sure that all of these foundational capabilities were shored up and we were able to offer something that was similar to what consumers are experiencing in other industries, like the travel industry, banking, retail, all of that. And that's really what we keep in mind as we continue to go forward. The other things that came out of that work is we set up some guiding principles for our digital work, which we always keep in mind when we're choosing technologies or deciding what we want to move forward with. And it's things like, making those experiences easy and low effort. It's focusing on the user and not our processes. It's leveraging the smallest number of connected platforms so that we can, manage our resources well and manage our relationship with our platform vendors. Additionally, it's personalizing those experiences based on what we know about our patients. We have a lot of information, so let's use that information to be relevant and helpful. And then also providing options to engage with us. I mean, digital, yes, is the place and where we want the experiences to happen, but not everybody is comfortable with that. And not every situation will allow for a digital interaction. So we wanted to be able to provide sort of this streamlined experience. So if somebody calls us or if they engage with us on our website or if they come into our offices, they're still feeling that it's a connected experience.
So what's the core platforms? I assume it's your CRM, it's your content management system for your website, and there has to be some aspect of a platform for delivering information to the patient real time. What other tools are we looking at in terms of the core platforms that you need?
Yeah, so the core platforms that we're really using in digital space, first of all, Epic and MyChart, that is foundational. We start there. So when we want to try to build something, can we leverage Epic? Is it possible? Can we integrate with Epic? So Epic and the MyChart portal are very key in what we're doing. And then additionally, our most recent launch of our new consumer app is really, and right now it's an extension of MyChart, but in a consumer-friendly, streamlined package. We're also giving them some additional information. And as we move forward, we will be integrating other potentially non-Epic capabilities into that app. And so we really want people to download that app, start using that as their key source. So that's something we're also using. Salesforce is our partner for CRM. So we have Health Cloud and Marketing Cloud, and we're really using that in a lot of different capabilities and hope to expand that out to help manage those consumer engagements, regardless of the channel, whether it's phone or chat or email or text. So that's a pretty key platform also. And then our external website and actually our new intranet are built on Sitecore.
Oh, okay. Interesting. And that's the core set of tools that you have today. But there's digital is crazy. I mean, it's just expanding in so many different directions. You have remote patient monitoring now, and you have telehealth and other things that need to get brought into those experiences. And are you expecting those kinds of things to get integrated into Epic, and then that's how it gets brought into your digital core?
That's really the first step. That's where we like to start because it's an easier integration. It's compact. We're able to have all the information about a patient in one place. So that's where we're starting. Now we know that there will be certain experiences that just can't happen in that platform. So we always are looking at other solutions that may be able to offer a better experience, better capabilities, but how do we still continue to integrate those into that full experience? I think, the thing that keeps me up at night is ensuring that we have a really easy, streamlined experiences for our patient. And, the more different solutions we sort of bring together, we have to be really careful at how we orchestrate those and how they appear to a patient. That's really a big focus.
Yeah, I mean, yes, from both perspectives, right? From the internal perspective, you talked about managing fewer systems and the ease of orchestrating experiences across fewer systems is just better, but also from the patient experience, that experience cannot look like you're interacting. They can't feel the fact that they're moving across 3 or 4 different systems. It's got to feel like a cohesive experience to them, I would imagine.
Absolutely. That is really key. And again, something that I'm always thinking about. I always get a little bit nervous as we start looking at different capabilities and, those key platforms, they won't be able to cover everything. I mean, I mentioned that we had launched a chatbot recently. Actually, we have a couple of different chatbots and they're each on a different platform. We also have some automated SMS types of conversations that happen on another platform, which is Well Health. And so we're really looking at how all those fit together. And that orchestration is a key role that we have to get right.
Well, you have a marketing background, and I don't know why this is interesting to me, but I think part of it is my experience. I've done some consulting with health systems, and I've gone into various ones, and it's interesting how different the marketing teams are from health system to health system, and some are still buying, billboards at the local baseball stadium, and they're doing victory laps, and they create a couple mailers and those kind of things. And then others I go into are complete state of the art. They brought in somebody from retail who really understands how, and they're really doing outbound type stuff, and really, so I've seen the difference between those, and one is very technology savvy and centric, and the other's really traditional. But what I found is that creates an interesting dynamic between IT and marketing. How have you been able to work with marketing and establish that relationship with marketing?
I think given my many years in marketing, I understand what marketers are going through, and I understand the challenges, and I understand what people ask for and what they focus on. I think that's been helpful. And in fact, when I arrived here, my team really was primarily a web and application development group. And as the months went along, we started thinking about, gosh, we're really looking at a lot of technology when it comes to marketing, digital automation platforms. And we actually worked very closely with our marketing partners here, and we moved the digital marketing team into IT to be a part of my team. So I think given my knowledge and many years spent in digital marketing and understanding the technologies and the approaches, I think that was a comfortable transition to make. And we continue to have an amazing relationship. And marketing, digital marketing, it requires still so much technology to be able to support those effective campaigns and outcomes. And we work very, very closely together. I have seen other organizations that do not do it well, but we need each other. And
yes, no, absolutely.
We get to work together, and we actually have a lot of fun doing it. I think we have a great relationship, and we've launched some really, really cool things.
Well, I hope no one takes this the wrong way, but marketing can be some of the most fun people in healthcare. So anyway.
Well, I don't know about that. I was a former marketer, so I'm not sure I can agree with you.
All right. Well, actually, you lead into the next question, which was building your team. So it was a new role, a new organization, part of the organization when you came into it. Give us a look as to what you were looking for as you were building out your team, what you were looking for in terms of talent, what you were looking for in terms of the capabilities of the group that you were putting together.
So I have a fantastic team. I was lucky that I inherited really, really strong teams, which is wonderful. And, the things that I stress and the team is so good at is they are curious, they're adaptable, they ask questions, and they figure stuff out. In technology, things change every day. So every day we come to work and we don't know necessarily how to do what we're doing because there's new things that are introduced. And so it takes a really special kind of person to come to work every day and say, oh my gosh, I have to, learn something new. I have to figure out how to do this. And so I look for people that love to figure things out, love technology, love the consumer, and really want to focus on our mission as an organization to really be able to provide these types of services to our communities. So it is not easy to find people with that sort of approach and attitude, but we've done a really good job at finding those folks. And I would say, with some of our moves to different technologies, some of our folks have had to completely relearn what they work on. We have people who never worked on Sitecore before. And now that it's also our intranet platform, we have folks who used to work on other platforms. Now they have to learn Sitecore, and they're doing an amazing job with it. Same with Salesforce. We have people who never worked on Salesforce before. learned how to do it and are doing amazing. So that's the type of person I look for. I mean, clearly, I would love to have some experience in some of the areas that we're supporting. But if someone is open to learning and figuring things out and being adaptable and not just being open to change, but actually being excited about it, they will do well in this space and on my team.
Interesting. So let's talk a little bit about culture. Right? And let's go in two directions here. One is establishing a culture within a culture. Clearly, SCL has a culture that your team operates within, but as you're building out your team, you're creating a culture within that team. I'd like to really, what were the things that you did to establish a culture for your team, and then what has it been like over the last 12 months trying to maintain that, given the curveballs that have been thrown
Yes.
at every leader?
That's a nice way to put it. I think, certainly you've talked to Craig Richardville, our chief information and digital officer, and he is truly focused on culture, building the culture. It really is everything. And so since he has gotten here, the culture has really shifted a bit. And I think people are definitely more, I think, even more engaged, come to the table with ideas, are looking at ways to improve things. Everybody's idea is important. And so that's really how I like to manage my team as well. We get a lot of opportunities where we innovate and ideate and come up with ideas. I always tell them that I don't have all the answers. I don't have the expertise in all of these areas. And so we all have to come together to come up with the best solution. And I think with the pandemic, we've just had to be a little more disciplined about continuing to engage and keep up with each other. So certainly some of the tools, we're a Google shop, so we use Google Meet. Google Meet has introduced many new capabilities like polling and whiteboards and things like that, which we try to bring into meetings to have more engagement. We also make the time for people to come together more informally. So we have a virtual lunchroom once a week that everybody can just drop in like they would if they were together in one building. We have teams that have set up lunch and learns about, non-work topics, about how to set up a vision board and how to raise bees and how to prep to climb your first, 14er. So it's a lot of fun. I think people are really enjoying getting to know each other in that way. And I think that disciplined approach, we need to keep that even after more of us are together. We really should be disciplined.
You brought it up. I assume you went to the lunch and learn. So how do you raise bees?
It very carefully.
No kidding. That's
very carefully. Yes, there's it's a whole art and science. It really is.
There are companies, there's a couple within healthcare, but there's also other companies, because I have a friend who's in this business of helping companies to establish like bee farms. I don't know what the best terminology is here, but essentially that their company has on their premises and whatnot, and they produce honey. I'm not sure I understood it. When he was saying it, I sort of shook my head. I should have listened a lot closer. But that's not what we're going to talk about.
It's quite interesting, though. Something I learned is that you can go online and buy your bees.
Yeah, that's amazing. Anyway, yeah, that's an interesting topic. So, talk about what's next for SCL Health. What if I were a consumer in your market, in your area? What could I expect from you guys? What are we going to be seeing in 2022 through 25 from your digital team?
Yeah, I think, certainly just more engagement, more opportunities to make it easier for consumers to access us and be engaged with their health journey. We do have a Mission Forward 2025 strategic plan for the entire organization, and we will continue to focus on that. There are things around growth, there are things around alignment with our providers and our clinicians. There's clinical and operational transformation and really aligning and empowering our associates also. So all of that work will continue, and there are a number of initiatives across SCL Health that will focus on that. If I look at digital services specifically, it's truly making that experience easy. So from a digital perspective, that's one thing. If they're calling in on the phone, we've got to give them a similar experience. If they're emailing us, and there will be expansions of, our consumer app and what you can do in that app. So I think it's really looking at experience and being able to provide that in such a way that is what consumers are looking for, what they're expecting, and easy for them to be able to do.
Yeah, no, that's exciting. I'd love to really go further with that with you, and because I think the consumer, if we looked at 2025, based on what we just went through with the pandemic, based on changing consumer experiences, the number of people that have accessed digital tools in healthcare over the last year has grown almost 100%, right? So almost everybody has interacted in some way with now an online scheduling platform or some aspect of a chatbot like you guys have rolled out, or some aspect of telehealth, obviously, and other things. And so we've now exposed it to almost the entire population. There really is an opportunity to see some really exciting things happen between now and 2025. Do you have a pace that you feel like you need to move at in order to stay up? Obviously, healthcare is still catching up to other industries, but just to stay on par or better with the new tech entrants that are coming into the space, and the payers and everybody else who's really moving. Is there a pace that you're looking at that you guys have to maintain?
I think we're at that pace right now. We have moved very, very quickly. If you look at what has been accomplished just in the last year and a half or so with our new leadership team here in technology, it is pretty substantial improvements in the Epic platform, even beyond, things that my team does. Improvements in security, improvements in technology infrastructure. All of this has been accomplished in such a short period of time. And I think if we continue to move at this pace, we're going to get a lot done. I think the other important thing in this, and the reason why we can move so quickly, is because the top levels of leadership in this organization are completely supportive of that and help us move quickly to get these things done. And these things have to be done for our consumers, for our associates, for our providers. I think the other thing that we continue to look at, and some of us have come from different industries in the past, and we continue to look at what other industries are doing, and the industries that are far ahead of us and have always been far ahead of us. And I think they can give us suggestions on where we're going, where we need to go. So we continue to get inspired by non-healthcare industries and what they're doing in the digital space. I mean, if you think about even just the pandemic, even those industries who were far ahead, great digital experiences, I mean, they really had to retool a lot of things. If you think about something as simple as the word contactless, that word I don't know that ever really existed prior to the pandemic, but now everything you can do in a no contact kind of way. And so even simple things like words that are being introduced to our world now, you can see where the change is going, how quickly it's happening.
It's interesting you mentioned contactless. I went to Disney World, and you could see that they've redesigned everything for contactless experience across the board. And any place where you could come in contact with something, they're cleaning it pretty often. It's just the new world we live in. All right, so a question I've started to end my interviews with, and it's really to give you the opportunity to talk about whatever I may have missed with the questions. And it's, what topic didn't we talk about that you think the listeners, the community might find interesting to hear from you on?
Gosh, we talked a lot about some really interesting, cool things. I think, one other thing that we've been exploring as we look at, what I call sort of the digital workforce. So chatbots kind of fit in that area around digital workforce, and we've been exploring robotic process automation to really understand how we can implement that mostly on the back end to be able to help us be more efficient, provide faster turnaround times for ourselves and also for patients and some of the activities that they need to get done. So that is something that we are exploring, and I do believe should be a pretty foundational part of our operational processes.
Yeah.
I think that, as we've been really getting into the discovery and understanding what's possible, there are a few health systems that have dabbled a little bit in this. Some have done it very well. I think there is still a lot of white space to be able to kind of fill in there. Other industries, of course, have been using RPA for many years and have benefited greatly from it. So it's something that we are going to be looking at.
Yeah, I mean, RPA itself is really fun technology to look at, and RPA as a technology has really advanced. I mean, they're layering in computer vision and other things on top of it, and it gets really sophisticated as opposed to some of the things we were doing 7 or 8 years ago, and it was more screen scraping technology. This is pretty sophisticated stuff that they have now, and really the sky's the limit in terms of the amount of backroom processes that we can take to the next level. So that'll be an interesting conversation to have. Are your plans near term, or are you in the planning phases at this point?
We're in the planning phases right now. If we're able to make a good business case for it, I would hope to see something in place in the next several months. We do actually have a proof of concept, very small RPA pilot that we launched a couple of months ago, which is going well. And this will really take that to expand it to really look at processes across our organization. As I think of it, eventually what will be really great is to have sort of a bot for everybody. So you have all these bots that people can just choose to use, and they have functionality, and you can just get those on your desktop and start using them. So there's just really, really great opportunities to do that. So still pretty early on, but I would love to be able to expand that.
Yeah, it is exciting. I've heard from some health systems who have done some really exciting things around that and really reduce the amount of errors on the claims and increase the throughput of especially on that side. But it's interesting because I'm hearing more and more RPA be talked about for IT backroom processes as well. So it should be interesting. Mona, thanks for taking the time and coming on the show. I really appreciate it. Great conversation, and I'm glad that Craig introduced us.
Thank you. I've enjoyed it.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.